Well, good morning, everybody, and welcome to another Shareholder Committee of the Care Dorset meeting here on the 7th of October. And the usual practice, I can remind you to turn your phones off, switch your laptops to silent, and please introduce yourself at least the first time you do for anyone watching online, particularly the press, who get quite annoyed when we don't say who we are. It's quite difficult if you don't recognise everyone. Okay, have we received any apologies for absence, please, Chris?
Yes, thank you, Chairman. Just to confirm that we've had apologies today from Councillor Nick Ireland.
Thank you very much. And I believe we've got Councillor Jane Sumper online, is that correct as well? Yes, yeah. Welcome.
Yeah, hi, sorry. I was going to come in, but I got a stinker of a cold, so
no problem.
Staying away.
Nice to see you again. Okay, item 2 on the agenda is minutes of the previous meeting, which was back in our lovely summer of July. I think it's really to note, unless there's any observations that anyone wishes to bring to our attention. Not seeing any. We're happy to note the minutes. Obviously, there's a further update about getting them later on in the agenda, so that's welcome. Not seeing any hands up. No. Okay, those are duly noted. The next item on the agenda is declarations of interest. I've got Councillor Taylor.
Thank you, Chair. Councillor Jill Taylor. Could I do a declaration of interest as my husband uses Care Dorset services?
Absolutely no problem. And I've done the cardinal thing, which is not actually introduced myself, which is Richard Biggs, Deputy Leader, standing in for Nick today. Okay, thank you. No other declarations of interest that I can see. Okay. Item 4, public participation. We've not received any questions or statements from anyone that I'm aware of. And item 5, questions from councillors. We've not received any questions from councillors in advance. Okay, item 6 is the forward plan on your agenda, which helpfully lays out all the items. Jill.
Thank you, Chair. I just noted that in the terms of reference, there's a comment that says reporting to full council annually on the performance of the trading activities of Care Dorset Holdings Limited. We don't have that on our agenda at the moment. Is that going to be coming to our agenda prior to coming to full council?
Yes, sorry, just confirm. That will be on the next agenda for December, and it actually goes to Cabinet and not Council. It should have been amended in terms of reference, but it's the Cabinet that effectively look at the annual performance. Thank you.
Thank you.
Okay, in that case, are we happy to note the forward plan? Thank you very much. Okay, next item on the agenda is item 7, which is the organisational update. There we go. John and Mark are going to present this, I believe. Yep, thank you.
Thank you, Chair. Mark Tyson, Corporate Director for Commissioning and Improvement in Adult Services. So I'll go briefly through the report for the committee. So the highlights to pull out. So we still continue to work. We're nearly at the point of finalising the contract and service specification. So we move out of the novation phase, novation contract from Tricuro and into a new bespoke contract with Care Dorset for the current and future services. The last pieces of work that we're just finalising with colleagues in Care Dorset is the kind of cost and volume model behind some of the services, but also on the kind of development trajectories that we're agreeing between us that will then be reflected in the business plan that is on the agenda later today and into the next meeting. And I think in that context, I've just put into the paper here sort of outline thinking around, and so the committee can understand how we're working with Care Dorset, sort of outline thinking about their next kind of 5-year trajectory around a turnaround phase, a development phase, and then kind of commercial maturity. And hopefully that just gives a sense of how we're framing the contract and how that, when the business plan comes, in a sense, we're on the same page around that. Some significant service developments since the last report. Members of the committee, I'm sure, will be aware that Sydney Gale House, in its current form, is now closed. All people who were living in Sydney Gale House have been supported into other accommodation, some in the Care Dorset wider service portfolio, and some into other independent sector provision in the Bridport area or wherever worked for them. There was a lot of joint work undertaken. It was a good solid example of joint work between our operations, our brokerage, our commissioners, and Care Dorset to support that piece of work. And so we've now started in the council the programme management of the redevelopment of Sydney Gale House, and there's a report into Cabinet next week to kind of continue the decision that Cabinet made a good few months ago now to invest in reablement centres, of which Sydney Gale House is very much likely to be the first to open on the Bridport site. Extra care housing, there's been a number of delays, which caused everybody much vexation, but we are now at the point of being able to welcome in the coming weeks new residents to St Martin's House in Gillingham. And I'm sure in the operational update, Care Dorset won't say a bit more about that. And again, the committee is probably aware that the Cabinet has agreed a new model for the delivery of day opportunities for Dorset residents. And of course, the biggest deliverer of day services for under council contract is Care Dorset. So we're about to embark very much again hand in hand on the conversations in local areas about what that model means for the development of services in local places, and very much a big focus on how we get flexibility and the kind of variety and different opportunities for people that people tell us they want, whilst also keeping, for those for whom it's needed, the kind of complex support, the safe space, and the support for carers that is very much at the heart of delivering day services. So we will start that in the coming weeks. We'll make some announcements in various places. We've got a lot of conversations to have, and so we're looking to do it in a phased approach, different parts of the county, in different points. But it hopefully is an exciting opportunity to refresh and modernise and reinvigorate the offer that both Care Dorset and the wider independent sector offer to people in Dorset. I think I've mentioned already the work we're doing now on the contract. The Section 4 here, finance, about the rebasing the contract for the new volumes that we're agreeing with Care Dorset. And I'm flagging here as well the current medium-term financial plan for the council. We're in a challenging position, and so we are having conversations with Care Dorset about the support that they can provide to us as a commissioner through that period. And so, for example, standing up the reablement beds has been incredibly helpful in avoiding long-term care costs. So I think it's not only a can we reduce the contract to the minimum amount kind of conversation, it is a conversation in a wider sense about what role Care Dorset plays in a balanced system of prevention and long-term care. We are coming through to Cabinet with an update on the Council's commissioning strategies. Again, without wishing to labour the point, that's all part of the conversation we're having around the context for the Council, for the Council's contract with Care Dorset. So it will all be in line. It's likely now that it won't be November Cabinet, it'll probably be December, I think, we're planning to come through with that piece of work. And so again, that will show the way we see Care Dorset playing a role across the kind of next 5-year period of the refreshed strategies. And that's the update from the commissioning side for the committee. I'm happy to take any questions, of course.
Thank you very much. That's really interesting. There's some really good work going on. I think we're all keeping a close eye on how that performs in Gillingham. It's such a hot topic, isn't it, nationally? and we really want to see this be a success and hopefully deliver things in a better way going forward and more efficiently as well. Are there any questions from members or officers? Sorry, Councillor Taylor, I didn't see that.
Thank you, Chair. It's just a thought I had at the bottom of page 16, where you've got your graph, which is fine, I get it. The second bullet point on the left-hand side talks about staffing model in residential to enable greater acuity. I think acuity is a really interesting word that is bandied around a lot in council speak. What exactly does that mean in this context? And is it acuity as regards to our needs, Care Dorset needs, but more importantly, the residents and the people who use the service needs? So how are you actually basically achieving acuity? So how are you listening? How are you hearing? More particularly about the people who use the service, because these are often very vulnerable people who can't express the needs that they've got. Oh, sorry.
So I think that's, and I'm sure colleagues in Care Dorset might want to say a bit more about it. So I think that's thinking about, so we know that there's a challenge for Care Dorset in terms of the estate that they've inherited, the buildings and what they allow. A lot of them don't have ensuite rooms, so sometimes higher acuity care. And very much when we're talking about acuity, we're talking about the people who are living in those residential homes and the requirement for care that they bring with them. And the journey, I think, over that longer period, but it starts with initially thinking about what is possible in the current services, but the journey is over taking the services so that they can deliver a greater level of, so for example, of acuity. So for example, support with behaviour that challenges services, support with bariatric and people who have particular needs around kind of more complex equipment that's needed to provide their care. And at the moment, some of Care Dorset's properties are the rooms are too small, the corridors are too small, and so they don't allow for that more modern, higher care requirement. And so, yes, there's a staffing question, and so one simple question is nursing care instead of residential care. So that's an easy, sort of a first starting point. But as we build things, for example, like Sydney Gale, the new Sydney Gale house, we'll be able to look at providing nursing care and other more intensive care environments. So it's about that question, not really acuity in terms of the services in cares of Care Dorset. It's about people. It's about people. And in terms of how we listen and how we understand that, well, obviously, we're doing a Care Act assessment, understanding somebody's requirement for care. And at the moment, somebody with the higher acuity needs, we can't place them with Care Dorset in all cases. I mean, there's some cases, but we want very much to be using Care Dorset more for those higher level needs in the long-term future. Does that help?
That's lovely. Thank you very much.
Before I go to Councillor Sompo, who's got a hand up, I think that's a really good call, actually. If we're using words that, I mean, I wasn't familiar with that word, I understand it. I think we need to explain what it means, because these are public documents at the end of the day that everybody's supposed to understand. So that's a really good point. Councillor Sompo.
Thank you. Thanks very much, Chairman. My signal cut out slightly, so I only got partially a point that Mark was making. So forgive me if I've kind of got it slightly wrong. Mark, I think you spoke about the standing up of reablement beds in relation to long-term care or connected to long-term care, and that Care Dorset were able to support. And as I said, I got cut out, so I didn't get that whole section that you spoke about. I wonder if you could just expand on that, please.
Okay, so yes, back quite early in the development of Care Dorset, so within the first 6 to 9 months, I think, we were in conversation about the need for bedded reablement support in Dorset. So somebody leaves hospital, needs a period of supported recuperation and reablement, and to get more back to independence, and we needed some bedded capacity. And Care Dorset were able to acquire and redevelop a building next door to the Castleman development, and for 30 beds that would, and from the rest from or elsewhere in their stock, in total 30 beds that have been providing that support. And so that's been incredibly impactful in a relatively short time in terms of avoiding the requirement for long-term care in people leaving hospital. And indeed, so 2 points. One, reducing any amount of long-term care required back at home when the person gets back home, but also reducing the number of people who are going from hospital into long-term residential care, which is, in a sense, one of the almost worst outcomes. We want to kind of, people to be back at home when they're making the decision about long-term care. Okay,
that's really helpful. Thank you. I thought that was what, but as I said, it cut out. I just wanted to make sure that it wasn't extending beyond the 6 weeks.
Yeah, we monitor length of stay in that, and actually, yes, it's we're comfortable with where length of stay is at the moment in those beds, and we work through the system with our partners in the integrated care system to ensure that they're playing their role in a bigger sort of journey, as it were, that people go through.
Yes, the system. Marvellous.
Okay, you happy with that, Councillor Sumper? Yep. Sounds like it are. Okay, we will ask to, sorry, Councillor Taylor. I'm hiding behind there.
Sorry, apologies. Could I ask another question, please? I've just sort of flipped through it and had another thought. Just talking about the St Martin's accommodation in Gillingham. I note that it's Magna Housing, Care Dorset and the council. How are they, I'm assuming Magna or Care Dorset, dealing with people who have choice, basically, and may choose not to use Care Dorset? And that basically has got to impact on the staffing levels that are being put in at the new place at St Martin's. I don't know whether that's a question for you or whether it's a question for Care Dorset.
Okay, Care Dorset.
Thank you for the question, Councillor. So you're absolutely right. People have got choice in terms of deciding the individual packages of care. We are commissioned to provide what we call the background support. So we provide the waking nights and the additional support that individuals need. And those individuals to whom, so that's basically around checking that they're okay, making sure that they're engaging with the community. We're commissioned to provide some community support as well as part of that package as well. Of course, we would like to be the provider for those individual care needs, but certainly some individuals that are moving in have a domiciliary care package already, and they may decide that they wish to bring that provider with them to their new home, and that's absolutely their choice, but we're there to provide that background support. And as individual needs change, if they haven't got an individual package at the moment, we'd like to be the provider for those individual care needs when their needs are determined that they need that additional care.
Okay, thank you. That's going to be quite difficult, I think, going forward, because I think you're going to have quite a few new people coming in there who will already have care packages. And at the moment, I don't think Care Dorset provides domiciliary care in the community. So you're going to be asking an awful lot of a lot of these patients who are already quite vulnerable. So I'm glad you're up for the challenge, because I think that's going to be the tough one. Thank you.
Okay, thank you very much. Are there any other questions on the report? I think we've had a good discussion. Well, we note them. I think we've debated the issues in there as well. And some good points made there. Okay, we now move on to item 8, which is the Care Dorset update. I believe, Chris Best, you're delivering that. Caroline, thank you.
Thank you very much, Chairman. I'm Caroline Tapster and I'm the Chair of Care Dorset, and what I'm going to do is just say a few words by way of introduction, and then I'll hand over to Chris Best, Managing Director, to take you through some of the detail in the report. We are celebrating our second birthday this month. It's now been 2 years since the transfer from Traguro. At that time, our priorities were to make sure that transfer was safe and legal. It wasn't without its challenges, but we are now, as Mark's already said in his report, moving into the next phase of, I think, improvement and turnaround. And in terms of some of the improvements, they're listed in the report. We have improved the levels of occupancy across all of our residential beds. We've reduced our colleague vacancy levels, which is really good news, and we've also reduced our agency spend, which we did talk about quite a lot at the last meeting, and that has resulted in some improved financial performance. I'm sure Chris will want to refer to. We've opened the Dorchester Road service in Weymouth for people, younger people with learning disabilities, and you've already heard about the St Martin's Extra Care housing, where we have a full team of colleagues who are in place ready to welcome the first people as they move in, which is really good news. A couple of other things. At the last meeting, we talked about the governance review that we were undertaking, and there'll be no changes to the structure of the board or its membership. However, we have completed a number of, I think, important housekeeping tasks. I would call them. We've improved our documentation. We've reviewed the non-executive director role profile. We've had an independent review of our approach to risk. And we've had a joint workshop with the board and our senior leadership team around risk management. And I've got another learning day for the board in November. We've also going to be doing a skills audit, which is going to help us in our succession planning and overall development of the board. So there's been quite a lot of work being completed. And finally, we also talked last time about our approach to listening and engaging with people who use our services. And we talked about our people with lived experience complaint scrutiny panel. We met with members of the panel at a last board meeting. We had lunch with them. The majority of the people there were people who used our day services. And what they told us was very much consistent with some of the messages you've already had from the day services review. They said they did not always want to be part of big group activities. They talked about some people getting a little lost or becoming withdrawn because they didn't want to be part of that bigger group. They would welcome more one-to-one interaction and also more individual rather than group activities. They said that. We heard about the impact of the COVID lockdown on people's mental health and well-being and just how devastating that was for many people. And this will not be news to any of you, we also heard a lot about the difficulties in transport, both in terms of being able to use transport during the day service, but also the lack of accessible transport, which particularly for people who used wheelchairs. And we heard that in one particular area people lived, there were no accessible taxis. And they said that did make their life very difficult and very, very challenging. I know you're aware of many of these issues, but I think it's important just to reiterate that as we look at the day services review and how we can improve and make a more individual community-based service for people, that there are going to be some challenges in that. I'll now hand over to Chris, who will pick up some of the operational details.
Thank you, Caroline. And apologies, I should have introduced myself earlier. I'm Chris Best, Managing Director for Care Dorset. As Caroline was indicating, we've got to our second birthday. And this year, we've given teams some choice and control in terms of how to mark that occasion. So over the last week or so, there have been a range of activities that have been going on along and around our services. For example, there was a ploughman's lunch for people we support at one of our residential care homes. One team decided to have a pizza night. There's been an afternoon tea, a sing-song and a buffet, and one of our day services had a party as well. So a real nice sense of activities and a real sort of buzz around the organisation, and anybody that follows us on our social media feeds will have seen some of the imagery around that. We're also delighted that our reablement team have been nominated for Care Team of the Year at the National Care Awards, and the final for that is at the end of November in London. We're up against some stiff competition, but our team are excited to be in the final for that. As Caroline was indicating in relation, our financial year ended on the 30th of September, so we're now in the process of our year-end position, which will be audited and then brought to this committee. We have made improvements in relation to our agency spend, and that certainly will improve our year-end position. But as indicated in the report, we think that we're likely to make a slight loss this year, or at best a break-even position. Our revenue is slightly behind budget. That's as a result of the delay in St Martin's extra care opening. In terms of operational delivery, as Mark was indicating in his update, Sydney Gale ceased to operate on the 16th of August, and a real sort of sense of partnership working between Care Dorset and the local authority. And our colleagues were incredibly professional and caring throughout all of that period. And indeed, we've deployed about half a dozen of those colleagues into services elsewhere within the Care Dorset operation. And we do recognise that there was a significant amount of change to the people we support, but as Mark was indicating, people have moved to other accommodation, and indeed in some cases moved closer to their loved ones as well, which was their wish and desire. Talked about St Martin's, but again, the team are moving into the building today. So the building has now been handed over, ready for people we support to start moving in from the middle of this month. So we're now in the orientation phase around the building and understanding the sort of technology that exists within the home as well. And then there's a phased approach to people moving in to their new flats. And the team have been well inducted into the organisation, having started at the beginning of August. In terms of workforce, as indicated at paragraph 15, our recruitment efforts remain effective, and we're carrying a vacancy rate that's about 5% of our overall establishment, so positive and certainly an improved position from the sector largely. We've invested a lot of time and effort in relation to our training compliance, and that is now close to our overall target, with a number of additional training courses as well, to really position our ambition around professionalising our workforce and ensuring that they are as skilled as they possibly can be. And just picking up on Councillor Taylor's question earlier on in relation to acuity, there is a certainly growing position where our colleagues are taking on sort of delegated nursing tasks and so on, and so particularly in our reablement settings, that reduces some pressure from health in terms of district nurses and so on and so forth, but also means that they are able to deal with a real change in the needs of the people that we're seeing within our care facilities, given that individuals are now tending to move in at a much later stage in their sort of ageing journey. And that certainly links with the Care Dorset Academy as well, which we've talked about in these meetings previously, and we expect to bring forward the plan for the launch of that in the coming months as well, and working with some strategic partners outside of the organisation as well, both in terms of some universities as well, to sort of bring some real support to those qualifications. And I think that was everything that I wanted to bring to members' attention. I'm happy to answer any questions.
Thank you very much. I've got Councillor Holloway.
Thank you, Chairman. I'm just wondering if you could just expand a bit further on page 22, which is number 4 on there, about the contract renegotiation, because obviously it states in your report that obviously those discussions were planned for the end of September, but then I see in point 9 on page 23, it just says that the negotiations are still, there's still a significant amount of work. So I'd just be keen to know if you can expand further on that for me, please. Thank you.
Thank you, Councillor Holloway. Yes, so we had a very productive conversation with our commissioning colleagues last week, and there was some additional work that our Care Dorset's finance team have completed and sent across to the commissioners. We've got a further meeting next week, so we're confident that we're sort of moving to a position of finalising those negotiations. There's been a little bit of slippage in terms of the time frame, purely to other matters, but we're confident that we'll conclude things before the end of the calendar year at the very latest.
Okay, no, thank you for that. And just another quick point, obviously on point 8 on there, where you just say you monitor, obviously Care Dorset monitors its cash flow carefully, but you say that there is no room for complacency. So are you still fairly confident that you will be able to remain fairly financial resilient over the coming sort of course of the time, years?
Thank you for that question. Yes, we are confident. We are in discussions with the local authority in relation to having credit facilities available to us for capital investment as well. But in terms of our revenue and overall solvency, we're confident that we meet those tests.
Councillor Taylor.
I've got a few questions, if that's all right. I'm sorry to be awkward. If I can just pick up on something that you just said in your introduction about your carers picking up healthcare roles to prevent the need for district nurses to come in. I think that is brilliant. I think that is absolutely right. But can I just ask, are the NHS paying for that?
Thank you. So it's included within the sort of funding that we have for the reablement bed. So that comes from the Better Care funding that exists around those beds that are the 30 beds that Mark mentioned earlier on. So that's priced within that number.
Okay, thank you. It's just one of my bugbears at the moment. Just going back to my other questions, you talk a lot about recruitment, and you're carrying about a 20% vacancy rate, which is, 20-person vacancy rate at the moment, which is fine and would be expected. I'm just wondering what your staff retention is like, because you're not mentioning retention anywhere in this paper.
Thank you for that question. So retention, we have a voluntary turnover number that is around 20%. So 20% voluntary turnover for the previous 12 months, which is still below the sector average, which is reported to be around 30%. There's certainly work to be done in relation to colleague retention, both in terms of the induction period, which is part of the learning and development review that I mentioned in my paper as well. But we're confident that that's around really embedding some of those practices that we've introduced. So, for example, we've changed the way that our one-to-ones are undertaken, and there's an embedding in period in relation to that that still has some work to be done.
Okay, thank you. I think that is an interesting one, because there's so many vacancies in the care sector in Dorset that we've got to work out how Care Dorset can be the best employer. And there's a number of things on that. I just wanted to point out something that is just one of my bugbears in papers, if that's all right. And that's when something comes out as doublespeak. And on 6, when you're talking about the financial situation, you've said that it's unlikely that Care Dorset will make a profit this year, and at best it will break even. I'd much rather have a little bit of honesty, which is what you said earlier, that it's likely to be running at a loss, because I read that and bristled, because that is what you're saying. It's likely to run at a loss and it may break even. And I understand that. That is absolutely fine. But I just don't like statements like that in a paper that are basically putting a gloss on things that aren't right. Just on the operational delivery, I know nothing about CQC inspections, so you may have to just enlighten me a little bit on this. You had a spot check at the lawns in Weymouth, and I'm just wondering, on spot checks, why do they do spot checks? Are they ever announced? How do CQCs work? Or do they just walk through the door in the morning and say, today I'm going to do an assessment? I'm talking as somebody who is an ex-UCAS assessor, and we always used to announce our visits so that people could get their houses in order first. And I'm just wondering if it works the opposite way within care.
Thank you, Councillor. So the inspectorate, or the commission as they like to be called, for registered settings, they're unannounced, so they can turn up at any point to carry out an inspection. For supported living settings, which are under what's called a domiciliary care agency registration, they are typically announced because often the files are often in an office that isn't there. Somebody isn't there all of the time. So they're often announced, and because in a supported living setting, individuals have their own tenancies and their own rights in terms of who comes across their threshold, the provider needs to then communicate with those individuals to ask permission for the inspectors to come and look at those supported living settings.
Okay, thank you.
Are there any other questions? Not seeing any. Oh, Councillor Somper. Thank you.
Thank you very much. Thank you very much for the report. I just wanted to ask you about the shared lives work that you're going to be doing. Obviously, that's been discussed, and you're hoping to push that forward in the next 3 months or so, and it will be transferring to Care Dorset. In what capacity is that? My understanding of shared lives is that it is people who are living within the community, mostly in people's homes, and as I said, living and working in the community. So I'd like to understand what that might look like. Now, that may be something you can't expand on at the moment, because you say it's the next 3 months, but the fact that you've consulted and it is transferring, I would have thought you would have some idea of what that will look like.
Thank you for the question, Councillor Somper. So the shared lives transfer is an as-is transfer. So the colleagues who work for the council at the moment and support the carers will transfer into Care Dorset and become Care Dorset colleagues. The shared lives carers who support people in their homes and in their communities are considered to be self-employed, and that status won't change. The payment for being a shared lives carer will still be administered by the local authority. So our role in the first phase is about ensuring that those colleagues that are transferring are well supported, and that they continue to do the great work and support those carers in the way that they do today. The second phase, which will happen subsequent to the transfer and once we've settled our new colleagues in, is about how we expand the service as well, how we take benefit from funding that's available elsewhere, to sort of really grow that service. And certainly Dorset Council are working in partnership with Shared Lives Plus, which is the one of the sector experts for Shared Lives in growing that service, and thinking about how Shared Lives might be used in the sort of rehabilitation space as well. So there's lots of thoughts and ideas that are being planned and progressed. But our priority at the moment is about ensuring that those colleagues that are within the Shared Lives team join Care Dorset well and settle in and continue to provide the great support that they do to Shared Lives carers.
Thank you very much. I think it's an excellent idea that Care Dorset take this on. My understanding that the service has been it's static, really. It hasn't expanded in the way that one had hoped. So I look forward to hearing what your plans are going to be on how that service is expanded. It's a very important service, and it's going to be increasingly important in my mind. So I'm very pleased to learn of this, but also to see in the future what your plans will be on that. Thank you.
I don't know if you wanted to come back on that at all.
Thank you. Just to say thank you, Councillor Sommer, for your support, and absolutely agree that it's a really valuable service that I think Care Dorset is well positioned to support and grow.
Okay. Firstly, I'd like to congratulate you being shortlisted for the Care Team of the Year Awards. I think that's really something that we should be proud and celebrate. You know, we deal with issues, but we also should be strong in supporting you and congratulating you. Just to get through to shortlisting is really good, so good luck with that. The only comment I've got, and it's been picked up to some extent by other members, but obviously on the financial side, which is due to the scheduling delay. I mean, obviously you've talked about your risk management process being, being sort of optimistic. I think with estimates is always an issue because risks occur. I mean, I assume perhaps some lessons learned, or the factors that were quite unique to that project. Which have you learned from that? That perhaps I suppose it's forecasting, isn't it? I mean, the last meeting in July, you seemed to be confident that it would be in September. Obviously, things have come around. Are there any lessons learned there, really?
There are always lessons, absolutely, to be learned. I think one of the things that certainly our colleagues have been really working on is sort of understanding the sort of organisation's cost base, and also unpicking some of the volumes and data that exists, so that we are in the best possible position to sort of negotiate an outcome that works for both the organisation and for our commissioners as well. And there was some complexity within that we hadn't quite foreseen.
Okay, thank you very much. I think we have duly noted that report as well and commented on, and had some good discussion. Item 9 is for urgent items. I'm not aware of any items being brought forward to us. And we move to item 10, which is exempt business. I shall read it out verbatim as is required. That in accordance with section 100A brackets 4 of the Local Government Act 1972, to exclude the public from the meeting for the business specified in the items below. It is likely that if members of the public were present, there will be disclosure to them of exempt information as defined in paragraph 3, part 1 of Schedule 12A of the Act, and the public's interest in withholding the information outweighs the public interest in disclosing the information to the public. So I'd like to move that. Do I have a seconder, please? Thank you, Councillor Taylor. All those in favour? Thank you. Okay, we will now move into exempt business. We'll pause while members of the public, thank you for your attention.